Hi, my name is Jamie Lambert, and I'm here today to talk to you about prenatal care. Prenatal care is the care received during pregnancy, and it's important for a mother to receive prenatal care so that she can have a healthy baby and a healthy pregnancy. I'm going to talk to you today about providers during prenatal care, about barriers to prenatal care, and then I'm going to talk to you a little bit about some unforeseen positive outcomes from prenatal care. A prenatal care provider can educate a mom and her family on childbirth, breastfeeding. They can also educate on nutrition and refer to community programs. And this is important because early intervention and education early on in a pregnancy can help set the scene for a healthy pregnancy. Some of the barriers to transportation include lack of education, lack of insurance, and lack of transportation. There are lots of community programs, again, available. Ask questions and ask for referrals from your provider. He or she has been in this line of work for a long time. This is what she went to school for, he went to school for, and they can really help you find the resources that you may need. I read a story on a blog written by Shelley Lopez Gray. She has her master's in nursing and she was a labor and delivery nurse for many years. And the story had to do with a woman who came into her ER who was 7 months pregnant. She delivered preterm and had never had any prenatal care. The mother left the hospital after a short recovery with permanent renal failure, which is kidney failure, and the child was in the NICU for a very long time. What happened was the mother had gestational diabetes and she'd never had any prenatal care. As you can see, it can become detrimental to a woman and her unborn child if she does not seek that prenatal care. The U.S. Department of Health and Human Services suggests that a mother attend prenatal care appointments to learn what activities and foods to avoid, and also for chronic disease management during pregnancy. The March of Dimes suggests that mothers attend all appointments to be monitored because lots of diseases and issues that arise during pregnancy that can be detrimental to the mother or the baby do not have any symptoms whatsoever. Preterm birth is something that is attributed to infant death, and preterm birth, as defined by Stanford.edu, is when a baby's born prior to 37 weeks gestation or 37th week in pregnancy. And some of the risks for preterm birth include uncontrolled diabetes, high blood pressure, depression, epilepsy. There are lots of other things, that's just naming a few. But early prenatal care is so important, especially if you have those issues, because a provider can intervene and help you manage those conditions. So the last thing I want to talk to you about are positive birth outcomes that you wouldn't suspect. And one of those is being able to save money through early prenatal care. Families and employers and insurance companies alike can save money if you prevent things before they become an issue. ForOurBabies.org had an interesting fact. They said for every dollar that an employer spends on prenatal care, they can save $3.33 in postnatal care, which is care after birth, and in morbidity costs, they can save $4.63. So for every dollar, you can save between $3 and $4, which is pretty crazy to think about. It goes back to the proverb, an ounce of prevention is worth a pound of care. I know it's cliche, but it totally fits here. So in conclusion, prenatal care is really important for a healthy mom and a healthy baby. They can learn about breastfeeding and childbirth education, which can really make the entire experience more positive. They can get early interventions so that complications can be avoided, and they can save themselves and their employers and insurance companies money. All around, early prenatal care is just the best choice for a mother during pregnancy. I want to tell you thank you. I want to tell you to please share what you've learned today. Take care.